So one thing, you alluded to about 6 months boxed up, and there was an interesting question which I pick up from the chat, and it's about how are health workers, how are doctors emotionally dealing with this being in the front line for so many months, and in your case, what are you seeing inside the ICU in the hospital, because you're seeing it very closely?
Oh, it's difficult. Geez, thanks for bringing that up. So healthcare worker wellness is a big avenue that we're exploring. Around 10% of all infected patients will be healthcare workers, and it's mostly frontline doctors and nurses, more so the nurses, honestly. And we've had here in New York City very close friends, very close colleagues, not only falling sick but also dying of COVID back in the spring, and it takes a huge mental toll on anybody. So addressing, if you're in the medical profession, addressing your team's healthcare wellness is a huge component of preparation. Just because we don't have a team, then your capacity to take care of infected patients when they come back is severely limited. I think the biggest struggle to me was in the height of a pandemic, the equation of whether I should be coming home to very young kids or no. And I think the depth of the abyss here was when my 1-year-old had a fever. Thankfully, it wasn't COVID, but the drama around whether I brought something from the hospital, was asymptomatic, and gave it to my 1-year-old kid was, I think, the lowest point of my experience here. So it's definitely something to consider, especially if you're in the medical profession.
Sure. No, thank you for sharing that.